This conference will now be recorded.
Hello everyone. So welcome to the MRCOG Part 2 course. This is by the MRCOG help and this session is particularly meant for those candidates who has just passed out Part 1. First of all, many congratulations for clearing out Part 1 so efficiently, so nicely. Now you are into the part 2, which is very different from the part 1. So it is considered to be the toughest step of the MRCOG, but actually it is not the toughest, but you actually have to do a smart study about it. So if you do smartly, then it becomes easier, and with guidance it is much more easy, because otherwise there is a portion of knowledge, portion of things which you have to study. So you have to actually find out what actually you need to study. So that is why we help in that way. For now, this is an introductory session. How about the part 2 exam is, what all you have to study in the part 2. Another important thing is that you should know the right sources, because if you are driving in a wrong direction, you are liable to reach at a destination where you were not actually started with. So that is why your focus has to be very fixed, and then you should know how to write on that particular way. Okay, so selecting the right sources is a very important thing. So let me take you through the journey of part 2, how you should go, so that you know what is the right way out. The course mentors are myself. I am Dr. Bhavna Kera, and I am from India, and my co-mentor is Dr. Juma Viswas, and she is working in London, UK. So we do together, do all the classes, and all take up all your questions and everything. So whenever you are with us, you are in direct contact with us, and or we are always there to help you. So welcome to the session, and this is the dates to which actually you all have to look upon, because you all are for the July. January bookings have already closed, so now whoever is going to book is for the July. So nowadays it is expression of interest form which you have to fill if you want to apply. So 10th January is the last, 9th March is the last date to fill the expression of interest form. So fill it before that, okay? Once you fill that expression of interest form, then you will receive the booking tokens on 28th March. Okay, and then accordingly the window will open and you have to book your exam. So do remember to fill your expression of interest form before Wednesday 9th March. Okay, this is the deadline for expression of interest. Once you fill the expression of interest, then only you will receive the booking tokens. Otherwise, you will not be sent the booking tokens. So this is one very important thing. Now, how the exam format is. It is a computer-based test, and you have two types of questions: single best answers and extended matching questions. Since you all have studied part 1, so you know what is single best answers. But EMQs is new to all of you. Single best answers is usually where most of the candidates actually pass and they don't find any difficulty. But in extended matching questions, you need a very thorough knowledge and a different perspective. So it needs a lot of uh, work in this EMQs, lot of practice you should do to get that perspective of solving these questions. So as it is suggested, single best answers carries 40% of the total marks and extended matching questions carries 16% of the 60% of the total marks. So EMQs is a very, very important part of this exam. You have to pass this EMQ to get through this exam, and this is where most of the candidates actually lag behind. So from the very beginning, whenever you start reading, you should focus on the EMQ practice and try to formulate the keywords, the important scenarios, how it appears, and try to fix up the things in your mind. Then in which situation what should be the answer. In a moment, I'll take you how you have to define the answers for these questions. We have two papers, paper 1 and paper 2. Both the papers are of 3 hours duration and total number of questions are 100. 50 are single based answers and 50 are EMQs. But the weightage of EMQs is 60%. So number of questions is equally divided, but weightage of marks is not equally divided. EMQ's weightage is much more than the SBS, 10% more. So EMQ, again, it is a very important part. Then there is a lunch break of 60 minutes, and then there is paper 2, which is also of 3 hours duration, again with 50 SBAs and 50 EMQs. And you have to pass in the total. 50% of the mark will be from the paper 1 and 50% of your final marks will be from the paper 2. So collectively, you have to pass both the papers. This is the EMQ, extended matching question. Okay, so in this question, you can see that there are multiple options. You may have around 10 to 20 options given, right? So such a huge number of options is there. Then there are 2 or 3 scenarios. In this particular example, there are 2 scenarios shown, but it may be 3 scenarios also. So you have a common pattern, like if a question is all about the postpartum collapse, then all the things will be matching to that only. If a question is based on preterm labor, then there will be the various scenarios of preterm labor, or maybe a single scenario of the patient as she progresses further. So such type of scenarios, one common topic, and questions are linked to that particular topic, and you have common options for these all questions. Okay, so this is one EMQ in which there are 1 question, 2 question, or there may be 3rd question also. Now you have to read this question and search for the options in this. So these all questions are very much close to each other. As I said, they may represent a single topic or they may represent a single scenario which is progressing over a period of time. Now, when you look at the question and you look at the options are so close to each other. And since there are so many options, so you may find 3-4 options which are matching to your scenario. So if you have not fixed things in your mind, like the rules, that this is the rule, if this is going to happen, this is the answer. If this is there in the question, then this is the answer. So like this, you should fix your rules. If you have not fixed your keywords, your rules, then it becomes very difficult. Another way of solving the EMQs is that when you read the question, you think an answer in your mind and just don't read the options previously. Okay, directly read the question and bring an option to your mind that this should be the answer. Now start searching that option in the options of the EMQ. You will find 2 or 3 matching options to the option you have decided in your mind. Now you can think which is the correct one, right? So now it becomes the SPA. When you have three options in front of you and you have to choose one, then it becomes like SBA. So such type of techniques are there which are required to practice in the EMQ. So you need a proper technique how to go for these questions, then only it becomes easy. That is why EMQ is a big lagging point in the examiners, in the candidates. So most of the candidates actually face problem because of less score in the EMQ. Syllabus of the Part 2 exam is divided into the 14 modules. So these are all the things from the Gynae and Obs, and there are some clinical governance and some important topics regarding the teaching and some topics based on the UK practices and the UK laws. So there are this all 14 modules are there. Like as in part 1, you had various subjects. You had 13 subjects. But here subject is only one. It is gynae and obstetrics. But syllabus is divided into the 14 modules. So modules are, module 1 is the clinical skills, 2 is teaching, appraisal and assessment, information technology, clinical governance and research. 5th is your core surgical skills, post-operative care, surgical procedures, ANC, maternal medicine, management of labor and delivery is one module, postpartum problems, gynecological problems, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, and urogyne and pelvic floor problems. So these all modules you have to cover one by one as we go ahead. So every module has some topics which are incorporated in that module, and it is mentioned in very much detail on the RCOG website. I'm not going into that much detail because when we start studying, we'll give you the leaflets for all the modules, like what all has to be covered in this module. All the guidelines or the reading sources which you are required to read will be provided to you. So module 1, like clinical skills, it analyzes your knowledge to rule out patterns of symptoms and identify the risk factors in women presenting with obstetric and gynecological problems. Assessment of a woman by means of clinical history taking and physical examination, and to manage problems effectively and to communicate well with women, relatives, and colleagues in a variety of clinical examinations. Teaching, it has altogether a different arena. We are not accustomed to teaching techniques and appraisals or any type of assessments like formative, summative assessments, your e-portfolio. All this is new to the candidates who are residing outside UK. So we provide you all the information you need to pass this in the exam, all the scenarios, how you have to cope up with these all things. And it also involves the ethical and the legal issues, the UK laws, like your Fraser's Gillett competency, your Fraser guidelines, your abortion laws, surrogacy laws. So there are multiple types of laws which are defined in the UK and they are not practiced by us. So they definitely need a proper attention. Clinical governance and research is also very much different from our perspective. So lots of statistics is there, incident reporting, risk management, confidentiality issues. Again, lot of questions come from the clinical governance. So we need to understand how the practice goes in the UK. Core surgical skills and surgical procedures. So starting from the consent advice, your hysteroscopy and laparoscopy, catheter use, cesarean section, NICE guidelines, cesarean section in second stage, third, fourth degree perineal tears, MVA, hysterectomy, abdominal incisions, enhanced recovery pathway, Bartholin cyst, abscess, sterilization, surgical management of miscarriage, minor cervical procedures, laparotomy for ectopic procedures, pregnancy and ovarian cystectomy, excision of the vulval lesion. So like this, we have a list of topics. So your homework becomes easy when we give you the list of topics and from the source where you have to read. Like everywhere it is mentioned. When you are reading the consent, you have to read it from the RCOG consent advice. When I say hysteroscopy and laparoscopy, I have mentioned here the GTG. So you know that this is to be read by from the GTG. When I say you have to read in catheter use in gynae practice, this is a TOG article. So actually, you actually spare a lot of time, save a lot of time, because once you have this ready, you know what is the source. And then when we take the session for this particular module, we will be covering in summary about these talk articles, all NICE guidelines and all GTGs related to this particular module. So if you have a summary in your hand, you know what is the correct source of study. So that's why it becomes very easy for you, and you can save a lot of time in searching the things. And we really save you from going on to the different path where actually, because I have literally seen the candidates who have been studying for 1 year or 1.5 years appeared in the exam twice or thrice, and later on when they come to us or they talk to us, we come to know that they have been following absolutely wrong guidelines which were not required, because RCOG only wants those answers which are mentioned in the RCOG guidelines. If you are following ASHRAE or you are following Australian guidelines or New Zealand guidelines, you are not going to be correct for the RCOG. RCOG will only take up the other guideline if it has been mentioned on the RCOG web page. Like if you put up that laparoscopy guideline, you go and search in the RCOG homepage, and if it is written that the guideline, the ASHRAE guideline is being followed, then only they will follow the other guideline, otherwise not. Like it is in the isoimmunization guideline. RCOG does not have its own guideline. It is the British Hematological Society guideline which is to be followed for the RH isoimmunization. And I tell you, most of the candidates don't know this, that there is a British Hematological guideline which is being followed by the RCOG. So this you have to go and search on the page, and nobody wants to go and search for each and every topic and to search what is the basic guideline which has to be read. So once you know this correct thing, that where to start and how to proceed further on the path and which is the right road to your destination, then it becomes very easy for you to follow that path. Like this, it is for all the modules. Like post-operative module will cover uterine perforation, urinary tract injuries in laparoscopic gynecological surgery, management of thromboembolism. Thromboembolism is a very, very important topic, and there is a very recent talk article of thromboembolism in gynecology. So it is a very important topic for the exam. WHO checklist, very much favorite of RCOG, nerve injuries associated with the gynecological surgeries. So once you have this all ready and you know the correct source, this is what I want to communicate, that knowing the correct source and covering the important topics, because there are few topics around which EMQ keep on revolving. Okay, so you have to make a list of those topics and be thorough with these topics. So then your process becomes very easy. Antenatal care in maternal medicine, there are two huge modules which have a variety of guidelines incorporated into it. You can see the long list here: amniocentesis, CVS, placenta previa, placenta accreta, vasa previa, antepartum hemorrhage, intrauterine growth restriction, female genital mutilation, IUFD, reduced fetal movements, monochorionic twin pregnancy, breast carcinoma in pregnancy, Antenatal care, NICE guidelines, diabetes in pregnancy, hypertension in pregnancy, multiple pregnancy, preterm labor, and PROM. All these infections and fetal medicine topics, they are also part of antenatal module. Various talk articles which are related to this module. So we actually make a list of talk articles which you have to read thoroughly. Some talk articles which you can just look at and go ahead, because reading the talk articles of last 3 years is must. But you cannot leave the older talk articles which are important, because some articles are covered only by the talk articles. Like you see, asthma in pregnancy. No guideline is there. There is only a talk article. MI in pregnancy, there is only a talk article. So you have to follow these talk articles very thoroughly. These are all the topics of maternal medicine, and as you see, we go various organ system like hematology. We are dealing with the liver, we are dealing with the GIT, then skin, then neurology. So you go system wise, and whatever articles or whatever guidelines are incorporated, you have to cover those. Nephrology, then surgical topics, management of labor and delivery. This is a very, very important module, and knowing the UK method is very, very important, because it is not, labor and delivery is not managed like in our Asian countries. There is a huge role of instrumental delivery still in the UK practices, and then assessing the CTG correctly and defining the mode of delivery is a very important task. And lot many questions you expect from labor and delivery. Even 2 to 3 EMQs are expected. 2 to 3 EMQs, when I say, it means each EMQ question will have 3 questions. If one set of EMQ will have 3 questions in it. So when I say 2 to 3, you see 8 to 12 questions you can expect from labor and delivery. And knowing about the UK procedures is very, very important. If you go by the way you are doing into your practice, you cannot do these corrections right. So now questions right. Now you have 10 questions out of 60. If you have 10 from labor and delivery, you can see how important this module becomes, and how important is to know about the RCOG perspective for these conditions. Postpartum problems, another important modules: postpartum hemorrhage, maternal collapse, sepsis, perinatal mental health issues. These all are important topics from this particular module. Gynecological problems, benign gynae, menopause, ovarian cyst, your chronic pelvic pain, endometrial hyperplasia guidelines, endometriosis, all these are very, very important topics, and many guidelines are there in this particular module. Subfertility, again a very good module. It is a small module but important. You often expect one EMQ, one set of EMQ from this particular topic, and you can score very well. There are few rules in this module. If you are thorough with those rules, you can very well score in this module. Again, the important thing is that your source should be right. This is sexual and reproductive health module. Lot of FSH guidelines are there. So since there are a lot of guidelines, so people often get confused which one to read and which one to not. So you have to cover most of these guidelines, but we give you the summaries of these guidelines, so it becomes very easy to cover all those fast. Sexually transmitted diseases, there are BASH guideline. You have to read the BASH ones. These will only cover all these. Again, there is a long list of BASH guidelines, but then you can save time with the summaries. Early pregnancy care. This is again a very small module, highly scored. You can score very well in this module, and I would say at least the infertility, early pregnancy, oncology, these are the modules which have direct questions, so you can very well score on these modules. And these are all you will have EMQs from these modules. So good way to improve your EMQ percentage with a small effort. So miscarriage, ectopic pregnancy, recurrent pregnancy loss, tubal pregnancy, cervical subclash, nausea and vomiting, then your gestational trophoblastic diseases. So all these will be considered in this particular module. Oncology also has some guidelines and some talk articles. So you have to go through these particular guidelines, talk articles. We do take important points from the strategy also, because some topics are covered only in the strategy. So from these we have to pick up the important points and we incorporate those into our notes, so that when you get the final thing in the form of the PDF or the recorded sessions, you have all the important concept from the important guidelines as well as the strategy topics. Urogynecology, again you have various guidelines. There is a NICE guideline, there is GTG, so you have to follow the rules. Talking about the urodynamics, very important part. So how to interpret those graphs and how to answer those questions, that is again a trick which has to be followed. Now, these are the various sources of study. Often people ask me, please send the books, soft copy of the books which are to be followed for the part 2. So very important to note that there are no books for part 2. These are all guidelines from the various sources. You can just go on the Google and put Green Chalk guideline on gestational trophoblastic diseases. That will come immediately on your first page and you can download the guideline from there. It is free of cost. You can also log in through your RCOG homepage into your account, and there also you can type in search the Green Chalk guidelines or scientific impact papers. So they are all free of cost. You don't have to pay anything for it, and you can download all the guidelines from there. And it is always good to get it from the net. For our course group students, we download and we put those in the course group for their benefit. But whoever wants to search on their own, they can easily search. And I see many times people asking on the groups, can I get a compilation of all guidelines? There are some booklets or some has been produced which have compilation of the guidelines. But I would suggest don't follow these compilations. Go and search guideline on your own. Why? Because guidelines are being updated. Okay, so maybe that compilation was done in 2017 or in 2018, and you have an old compilation in your hand, and looking at a compilation, you are just going and reading it, and then in exam, because the guideline was updated, so answer is different. So always look for the new guideline. So best way to look for the new guideline is go and write on the Google and search it, or go on your RCOG homepage in your account, and from there you can search. Whatever guidelines we provide in the group are all the recent ones, so you can always take the advantage of that. Okay, so this is the way you are going to search the guidelines. Green Chalk guidelines are the RCOG guidelines. NICE guidelines are produced by the NICE. There are some topics which are to be covered from the NICE guidelines only, like your early pregnancy and miscarriage, ectopic pregnancy, then your diabetes, then your hypertension, premature labor, endometriosis as a NICE guideline. So in these topics, you have to follow the NICE guidelines, okay? Even if like in ectopic pregnancy, you have a NICE guideline, you also have a Green Chalk guideline. But your EMQs are more focused when you have used the NICE guidelines to answer the questions of the EMQ. Okay, their answers are more directed towards the NICE guidelines. So NICE guidelines are very, very important for the EMQs. And it is very important to remember these guidelines step by step. Talk articles are not available free of cost. They are when you actually subscribe, then you get the talk articles. But Many talk articles are being posted in the groups. You don't have to subscribe particularly for it. You will be provided the talk articles. We do provide to our students, and otherwise also they are available in various groups. So you just need to search and read and do that. And the older talk articles are also very important. Some topics, as I said, have been covered in the talk articles only. Last year's talk is the must to read. SIP, this is the scientific impact papers. They are published by the RCOG in on particular topics. Okay, so you have to read these scientific impact papers, some impact papers which are important. So all the impact papers you obviously cannot read. There are many impact papers, so it is not possible to read those impact papers, but at least the recent ones and few which are important. So that should be read at least. So now recently a new scientific impact paper has been published on the risk reducing salpingectomy and surgery. So this new paper has become the important one. FSH Guidelines, which is Faculty of Sexual and Reproductive Healthcare. This carries a lot of guidelines, detailed guidelines for your contraception topics. Contraception topics is a very, very important topic for the exam. There are many guidelines, all types of contraceptive measures, emergency contraception, postpartum contraception. So it becomes very difficult for the candidates to read on its own. But if you are reading on its own, go through at least the highlighted points, the dark points, at least go through them, and the tables and the charts in these guidelines. Those who are with us, we provide you the summaries of these guidelines so you can easily go through that. Nice LARC guideline is also there, long-acting reversible contraception, which is again a good source for the contraception questions. Then there is a BASH guideline, British Association for Sexual Health and HIV. So there you have the guidelines for all the infections, chlamydia, gonorrhea, syphilis, all are covered in this. Syphilis, you have a recent article also. So you have to keep on correlating the things, what is coming new. So always you have to be very much particular about it. Now what I'm going to tell you is that how to read the guideline. Like this is your green chalk guideline, how you can make your reading efficient. Quite often students ask me that we read the guideline, I've read the guideline twice and thrice and then I forget everything. So how to remember the guidelines? What should be your effective way of reading so that you can take out the important points from it? See, RCOG has a very few particular points around which the questions revolve. So you need to know those particular points very well, and there should be no overthinking. Whatever rules are there for the RCOG questions, you have to follow the rules. So don't overthink. Overthinking is a very much big enemy when I talk of part 2 exam. Follow the rules as they are given in the guidelines. Okay, so you have to implement the rules as it is. Our work is to highlight those points around which the questions revolve, and then your work is to try and practice the questions and try to implement that particular rule in the questions. If you do like this, you will never forget a guideline. So like this, I'm giving you an example. So like this is a guideline for the gestational trophoblastic disease. So you see the most common presentation is irregular vaginal bleeding. So now when you have a question, which is the most common presentation, or you have this type of presentation in your question, irregular vaginal bleeding with positive pregnancy test, so you know that you are dealing with the scenario of gestational trophoblastic disease. Definitive diagnosis of molar pregnancy is made by histological examination. Now see, look at this particular thing. So now this has implications. What is the first line diagnostic test for the gestational trophoblastic diseases. So first line is ultrasound. But what is the way you can do the definitive diagnosis? So that becomes the histological examination. So read the question very much carefully, and you should have a rules. First line is this, but the definitive one is this. So once you remember these two lines, you will never forget it in the exam. So make a rules like this so that it becomes easy for you to revise the guideline when you are doing it again, and the questions are based on these rules also only. So you have to remember only those points. Which is the main management option? So suction curettage is the main option. Now there are often important incidences whenever you read a guideline. So separate those incidences out. We do in our notes, but those who are reading on their own, they can mark, and either in front page of the guideline, which is empty, or in the last page of the guideline, you can make a block and write all important incidences. And off and on keep on revising those incidences. Good is to do the group study. In a group study, you keep on discussing these incidences. Someday a person can ask some incidences from the other day other person can ask. So this is the only way. Repetition, repetition, and repetition in a group study. Discussion is must. The more you discuss, more you will remember in the exam. So always try to segregate the important incidences in a particular place. Now, like I said, how are molar pregnancies diagnosed? So you have first line modality ultrasound, but definitive is histopathology. So now when you have an exam question, whatever is being asked, you can write accordingly. Management, if I talk of, then important things are suction curettage, follow-up, registration in specialist GTD centers, and contraception. So when I talk of management, I will talk in 4 particular heads. Suction curettage, how to follow up these patients, registration is important, and what is the contraceptive measure is to be used. So now when you have so much, you have compressed the guidelines into points like this, then it becomes very easy to remember the guideline. Let me elaborate one. Like suction curettage, if I say, then what are the indications? All cases have to go for the suction curettage of all the cases of complete and partial molar pregnancy. But what is the exception? Wherever it is an exception, that is an important exam question. So exception when the size of the fetal parts deters the use of suction curettage. Because in partial mole, there is a fetus also. Okay, so if your fetal parts is so much big, and at that particular time the vesicular mole is diagnosed, then it would be difficult to go for the suction curettage. So in such patients, you can go for the medical management and get the pregnancy expelled by the medical treatment. So now you have a very clear this point that all cases will be managed by the suction curettage. Only one exception is there. And this is a very important point when you get the questions about the molar pregnancy, because at that particular time you become confused. What is the right method? NTD prophylaxis is to be given all to the patients. Preparation of the cervix by the misoprostol prior to the evacuation is safe. This is a very important point when you talk about the management of the molar pregnancy. Questions do revolve around this point. Use of oxytocin infusion prior to completion of removal is not recommended. Again, a very favorite point of RCOG. If the woman is experiencing significant hemorrhage prior to or during removal, surgical removal should be expedited and the need for oxytocin infusion weighed up against the risk of tissue embolization. So now you know what is important in surgical curettage. I'm not telling you to read the procedure of the surgical curettage, but the question comes from these 4 points. So now I've given you these 4 points and you remember these 4 points, and that's all. Whenever you have in EMQ such a question, fix these points there. So a very clear perspective if you have in your mind You will not be confused. If you have a lot of things in your mind and you see a EMQ, you are more likely to get confused because options are very near to each other. Then secondly, in some guidelines, you have such type of flow charts. This is not from the GTD guideline. I have taken this flow chart from a different guideline. It is from the 37B, that is management of thromboembolism in pregnancy. So this is a flow chart. Very much favorite of RCOG. This algorithm approach you have to go for. Like if you suspect patient with PE, what to do? You will do these blood tests and start the low molecular weight heparin. So like this, you have next step. If you have signs of DVT, what to do? If you don't have signs of DVT, what to do? So my purpose is not here to elaborate this algorithm because whenever we will be doing the GTG, we will be doing all the flow charts. But what I want to say is that these flow charts is an important source of EMQ. You have to know step-by-step approach. If you forget one step, your EMQ will be wrong. So you have to know what is the next step, what is the next step, what I should do. Like it is important that when you suspect E, you have to start low molecular weight heparin. But before doing that, you have to do the FBC, urea electrolytes, and LFTs. Now, if you forget this and immediately jump on to commence low molecular weight heparin, then your question will be wrong. You have to start the comments low molecular weight heparin, but what has to be done prior to that? You have to check the blood counts. This is patient safety because you have to check all this and then you can give the low molecular weight heparin. So you cannot miss this important point. So these all things need to be highlighted, and I would say whenever there are any algorithms or charts, particularly at the back of the GTG, they have appendix. In that they put important charts. So please go through with these charts very thoroughly, word by word. Sometimes it's just a difference of and or which makes a difference. Like if you are talking of SGA questions, what all you are going to look into in the ultrasound scan. So there may be a question that you will look for the AFI, you will look for the estimated fetal weight. So there could be AFI and estimated fetal weight, or it is AFI or estimated fetal weight. Okay, you understand the difference? And means you are going to look for both. And or means either you will look for AFI or you will look for the estimated fetal weight. So now you have read in the guideline that both are the written, but you have not paid attention whether it was and or. So such a small thing, such a small difference can make a huge difference in your marks. Okay, so this is very, very important. Now coming to the NICE guidelines. NICE guidelines are very important for the EMQ point of view, and I tell you that it is more difficult to read the NICE guidelines as compared to GTG, because in NICE guidelines they have not given anything in detail. There are the points, and you have to remember these points, and also remember the step-by-step approach. So you have to go through the guideline and we help you do in doing that. Important is that there are words like offer, recommend. Okay, so when they use the word offer, that means that you have to do this. Okay, you can recommend this to the patient. So this you can recommend means there is if and but. You can or you cannot. So it's your decision. So these small words make a huge difference when you make your rules. There are NICE pathways where you have this step-by-step approach. Like if you are approaching a patient of pregnancy of unknown location, what you have to do? Your next step is to measure the HCG levels. So immediately, if you have read these pathways, you know how to proceed with this particular question. So any scenario with pregnancy of unknown location, how you have to proceed? You have to do the HCG levels. Now, how do you have to proceed with HCG levels? So if your HCG levels decreases more than 50%, then you have to follow this way. If it is increased, then you have to follow the antenatal care. If it is in between, it is likely to be ectopic. So these pathways help you a lot when you are dealing with your EMQ questions. Where can you find the nice pathways? When you go and put this name on the Google, like nice ectopic pregnancy, this thing will come and appear. So from here, download the guidance PDF. You can click here and download the guidance. And here you see the nice interactive flow charts. Here you can click and go for the nice pathways. And I would recommend for all nice guidelines, please go through these pathways. They help you a lot in step-by-step approach. This is the scientific impact papers. So these are simple articles, like things they are written, and it is really difficult to read complete papers because 3-4 pages are there. So it is good you have your summaries in hand. Either you can do it for yourself or you can pick up the summaries. Sometimes they are in the group, some people share, or some are provided in the notes of the various courses. So, but you should know which are the important scientific impact papers you have to read, and those have to be read because questions do come from some important scientific impact papers. Talk articles. This is very important. This is a talk. Obstetrician and gynecologist. This is general. This is published by the RCOG and it is published quarterly. So you have 4 generals in a year. When you open up the journals, there are articles like you see here 1, 2, 3, 4, 5, 6 articles in one journal. So you have to read these articles, and again you need to remember the important points from it. SBs are often focused. Of late, the content of the articles has appeared in EMQs also. Okay, in the end of every talk articles, there is a CPD question. You can say here, there is a CPD written. CPD is basically true and false type of questions are there. So initially it was an impression that people used to think that if you do the CPD questions, you are okay with the important points. But now it is not so. They ask about the questions. So at least if you are not able to read the talk articles, at least read the important charts, important tables, and we do try to cover the talk articles as per the various modules. Okay. And we sometimes take free sessions also for the talk articles. So those who are in the free group, they can always keep checking. Whenever we have free talk article classes, we put the links and you can always join. Some of the talk article recordings are also available on our YouTube channel, which is MRCOG Help. So you can go and subscribe to that channel. There are some talk article recordings on it, 10 to 15 minute recording for one particular article. So you can go and listen to that. Then it becomes very easy for you to remember. So MRCOG Help YouTube channel. For our course students, they will be definitely getting all the summaries. FSH Guidelines, Faculty of Sexual and Reproductive Health. As I said, there are many guidelines related to contraception. So you have to go through the important points. If not all guideline, at least read the important charts, tables, and the highlighted points. BASH guidelines. These are for all the infections. So your sexual and reproductive health module actually are covered by these 2 guidelines. It is not from your GTG primarily. These are from the BASH and the FSH guidelines. So again comes the importance of correct source. Various books are available for the practice. These are few of the recent books which are to be done for the practice. The problem is that in some books you get according to the modules, but some books do not have according to the modules. You have a mixed questions from everywhere. So it is always good if you are doing a group study to divide the books among yourself, because there are many books of practice. These are 4. These are many more books, and you can practice as many as you want to do, because the more you practice, more you will. It's like maths. You have some formula in your hand. I have given you some rules. Now you go and practice it on the sums. The more sums you do, the more nicely you can do in your exam. So it is like that only. When I give you the rules, you go and apply those rules to the questions. So more you apply to the questions, more you will be well versed with those rules. So this is very important to go through all the books. Nobody can go and search the question from all the books. Many books have do not give them in the module form. So in a group, it is good that you divide the books. Like two books, one person can take, or if you are 10 people, you can take one book, and then one person will have to go and look into the questions related to the guideline or the module you are reading. Because how you are going to read is that you are going to do some guideline, read the guideline, like you have done the gestational trophoblastic guideline. You have read that guideline, go and search the questions related to that particular topic. Okay? Or you can do is that you can pick up all the content for the early pregnancy module, read all the guidelines, and then go and pick up the questions for the early pregnancy module. So both way it's fine. But one person will go and search the questions from one book. Other person is searching the other book and bringing in the questions. So if 10 people search, you will have a good pool of questions related to that particular topic. And then it becomes very easy. So you all can practice on those questions, and that saves a lot of time. If you go and choose questions from all the books, it takes a huge time. So group study, group discussion, repetition, and knowing the correct sources. This is the key to success for the part 2. How we help? We cover a complete course, including statistics. We give you guideline summaries. Live sessions are there. Special attention we pay to the EMQ solving techniques. Then there are around a question bank of 1800 questions where you have a online practice, which is exactly like your computer-based exam. And then finally, you have a final mock at the end. Previous paper questions we try to discuss completely. Personal attention, interactive sessions are there. So everything you need is here. So let's do it now. So you can do happy reading with the MRCOG help. Now I welcome all the questions. I've given you how the exam is, what type of questions you have in the exam, how the syllabus is divided, and how we will be covering the syllabus, and how one should cover the syllabus. What are the various sources of reading? Any questions? All are welcome.